Welcome, everybody. Soyez tous les bienvenus. Anamikaje. I hope that you are all as excited as I am about the official launch of the Planetary Health Community of Practice and Webinar Series. My name is Christina LaPearl, and I am the Education Liaison at the International and Global Health Office at the Faculty of Medicine. My role today is to provide you with some housekeeping remarks. Please note that this program will be recorded. By joining these program sessions, you automatically consent to such recordings. If you do not consent to being recorded, please exit this session now and view the recorded session when it is available. Recordings will be made available on the Planetary Health website. We pay respect to the Algonquin people who are here, the traditional guardians of this land. We acknowledge their long-standing relationship with this territory, which remains unceded. Nous rendons également hommage à tous les peuples autochtones qui habitent Ottawa, qu'ils soient de la région ou d'ailleurs au Canada. Nous reconnaissons les gardiens des savoirs traditionnels jeunes et âgés et nous honorons aussi leurs courageux dirigeants d'hier, d'aujourd'hui et de demain. Questions will be answered after Dr. Redvers' presentation. You can type your questions into the chat or use the raise your hand feature. Ce webinaire sera présenté en anglais, mais les participants auront aussi la possibilité de poser leurs questions en français. And now I would like to welcome our most esteemed Interim Director of Planetary Health, Dr. Hussein Malouf.
Thanks, Christina. Anyway, welcome to all of you who are here. We are, as Christina said, we're super excited to get this Planetary Health webinar series off the ground. I want to acknowledge the Internationalization Global Health Office, Christina, Diane, Sir, Megan, who's there now, like really put in a ton of work to make this happen. And so, yeah, like I really wanted to acknowledge them before we went on. We've managed to put together, I think, a series that is going to be very interesting for you. We have some international and national thought leaders that will be coming up during the next, I guess, today and then the next 5 months after. And we really want this to be action-oriented. So hopefully this will be good education, but built towards action, as we have our Planetary Health Council, which is starting up. And it's to, I know there's a lot of action going on in different departments. It's to kind of bring everyone together so people know what's happening. And we hope to use this as part of that foundation, building that community of practice. So please join us every month. If you can't, we understand, like people have busy lives, busy schedules. We will, as you know, it's being recorded and it'll be put on the Planetary Health website. So that's that. Yeah, we can go to the next slide. There's this community of practice that we have along with this. And so with each lecture, there are some activities which we have after there. We've tried to make them really not onerous. And at the end of all this, you can get a certificate, and we have some merch as well. We can go to the next slide. Is that the one with our pin on it? Sorry, I don't have control over there we go. Perfect. So if you do all 6 and you do some of those reflection activities, you get a certificate. But we've got these little pins that you can put on your lanyard as you walk around, so people know that you are Planetary Health certified. And hopefully, again, just be another talking point so people can engage in conversations about this. As we all know, conversations are really important. So yeah, that's it from that standpoint, and we can go to the next slide. So as you know, today it's our first webinar. I think what I want to acknowledge is to all of you is that planetary health is not a new concept, and we will hear about that today. And that's why we are. We can actually just go to the next slide about Nicole. That's why we are so happy. We really wanted to start this webinar series. It was a really important webinar series for us, and because it was so important, we really wanted Dr. Redvers to kick it off, because she is such an international kind of thought leader in this area. Indigenous thought in planetary health should really be the basis of everything that we do, as Indigenous people have been living these principles of planetary health for the last thousands of years. I'm not going to go into Dr. Redvers' whole biography because she is exceptionally well accomplished. Just to say that, I mean, I've had the misfortune and fortune of being on panels with her. The fortune because she's an incredible speaker, the misfortune also because then I follow her and she's an incredible speaker, and so it's a bit of a letdown. And it's always so inspiring to hear her. She is the first director of Indigenous planetary health I'm not sure, like I don't know if another position like that exists anywhere, but for sure in Canada, I don't think it does. She's also a research chair at Western in this area. She's an associate professor. She's awesome. And so with that, I'm really excited. Dr. Redvers, Nicole, thank you so much for being with us today. I know your schedule's really busy. I know you have a flight that you're going to have to like drive to catch after this. But thank you for kicking this off for us, and welcome you to take over.
Thank you. I'll just go ahead and share screen here. Bear with me for one moment. Get that loaded there. So I'll just make the assumption that you can see my slide and hear me okay. If that's not the case, please let me know. Thank you for that warm welcome. Really happy and honored to be with you all here on this beautiful evening, at least where I am. The weather is just still so warm for this time of year, which is also, problematic for some of the context that we're talking about today. Now, one of the important components of, where I come from, and for those, of course, that are familiar with Indigenous community work, our accreditations, our credentials, our educational lines don't mean really too much in community. And instead, our positionality, our relationality, our land bases, our ancestors are incredibly important for who we are. But most importantly, we often root our work within our relations to be accountable and to remain accountable to all our relations, or Salatina, as we say in my Denisuflene language. And it's really important to note that our Indigenous ways of being, our Indigenous ways of knowing, and also our lived experience have been informed by tens of thousands of years of memories that are stored in our region's stories. And stories really are our main clinical method, rooted really directly in the lands that we come from. Therefore, when talking about this subject in particular, I must always honor my ancestors and my elders, as anything I share or talk about from my Indigenous way of being is it's not my knowledge, it's not my expertise, but it's the collective way of knowing of a group of people that stretches thousands of years within my region. Now, our Indigenous methodologies for well-being stem from a rooted, decolonized state of being that could be said to be premised on 4 R's, which was really well described by Kirkness and Barnhart many, many years ago. That of which is respect, which is relevance, which is reciprocity, responsibility. However, with direct underpinnings in transferability to our kinship relationships with all planetary elements and beings. Now, this idea of how we formulate our relationships are really rooted in a framework of knowing that prizes interconnectedness as a fundamental component. So if I think about how to turn this interconnected worldview, this interconnected relationship that we have to all things, including land, into a clinical methodology for health and well-being, how is this done? Well, of course, there's already methodology. There's been a healing method in existence for thousands of years in how to live, but also heal sustainably. And all are based on sacred natural laws, which then define what we call traditional protocols or guidelines for walking in the world in a good way, which then give a framework for the modern world's scholarship, governance, but also healing. Now, these sacred natural laws, and in some regions of the world, it's called first law, original law, law of the land. These sacred natural laws are traditional protocols or our guidelines, and therefore our frameworks for healing are all done through the respect of ceremony, which is in and of itself a critical action in reciprocity. So why does this matter? And I often show this image because the world has clearly changed. We have went from a circular and natural worldview to a square synthetic worldview. And I often ask folks to take a moment to really look at this image and see how it makes your body feel when you look at it. So how do we get back to our origin? How do we decolonize ourselves and teach others the natural laws and protocols that allow for a more sustainable world? Because the health effects are clear. The land is a healing place, not just because of what it provides us, but what it gives us in relationship. Now, as Indigenous peoples, our relationship to Mother Earth as our mother means that we will do anything to protect her. There's also, however, a risk and an actualization occurring in many areas in regard to the tokenization of Indigenous traditional knowledges without the consequent support for Indigenous land and place rights, which ensures the continued marginalization of Indigenous peoples' knowledge over them as peoples and communities. So there's a prioritization of the knowledge over the peoples, but of course, the knowledge does not come without the peoples. Now, Indigenous peoples currently host and live in relationship with 80% of the remaining world's biodiversity, and yet live on only 22% of the Earth's surface. Now, just to put that in context, Indigenous people make up about 6% of the global population, approximately 6% of the global population. So 6% of the remaining, 6% of the global population is caretaking the remaining 80% of the world's remaining biodiversity. Yet, we are still having our lands taken, being killed or jailed for defending our lands, and being subject to political marginalization, leading to some of the worst health inequities on the planet. And what many fail to realize from our perspective is that violence against the land is violence against women, as we see so powerfully depicted in this artwork by Katie Douglas. The land is our mother, so when we lose value for the land, people lose value for the woman. Vanessa Gray. And of course, Indigenous people live in parts of the world where its impacts are greatest and depend largely or exclusively on the natural environment for our livelihoods, culture, and lives. Now, we are in a time of great change. So how can we think about solutions? And as denoted in the introduction, planetary health, at least within the Western way of thinking and applying knowledge, is relatively new. Although, of course, the conceptualizations of planetary health have been around in Indigenous communities for thousands of years. Now, it was formally defined in English in the last 10 years or so, about 10 years or so. And its origin and Western applications were originally very anthropocentric or human-centric in nature, and is somewhat still the case today. However, this is very much improving. Now, the Planetary Health Alliance, which is based out of Harvard, redefined planetary health as of December 2021 because of this anthropocentric nature that was encapsulated within the previous definition published way back by Whitney and colleagues, I believe, in 2015. So the new iteration of the definition is planetary health being a solutions-oriented transdisciplinary field and social movement focused on analyzing and addressing the impacts of human disruptions to Earth's natural system on human health and all life on Earth. Now, the planetary health movement seems to have struck a chord with many health professions, otherwise I don't think we would be here today, with many health systems around the world adopting or signing on to planetary health movements, recognizing the important role that healthcare providers can play in this area. There's still, of course, a lot of work to be done. However, with more exposure, we're seeing more awareness in this area. And it's amazing to hear about all of the various global initiatives that are happening on a country by country basis. Increasing literally every quarter of the year. Now, considering an Indigenous approach, planetary health as a field, or even as a framework, is primarily a Western construct, as Indigenous traditional knowledge systems have absolutely no clear separation between the health of the planet and health of self, or that of the community and ecosystem at large. We are in and of itself nature. We are nature. We are the river. We are the lakes. We are the land embodied with us. So what this means is that the meaning and applications of planetary health are directly rooted in our community values based on protocols for living in harmony with all that has existed for thousands of years. So when we think about planetary health, especially from an Indigenous perspective, we can think of it as being nested into an interconnected relationship with all other innate and applied knowledges that exist in the world, which impact the health of our communities and ecosystems. Now, this directional, multi-directional impact of all of these various interconnected levels and relationships is incredibly important as we help to form our reality, just as much as we are bound by some constants. So how can we think about planetary health in practice? And you'll be hearing, about a number of different solutions and progress made within this area. However, in the last few years, I coined the term patient planetary health co-benefit prescribing, which is a mouthful, but essentially what it is referring to is overarching framing or an overarching terminology to really denote any prescribing practice or clinical advice given that explicitly takes into account both the patient's and the planet's health in the action of prescribing. So why the need for this terminology? Well, I'm a member of the Dre Nicole First Nation from our traditional lands, which are called Denede, or Land of the People, which is otherwise known today as the Northwest Territories, Treaty 8 territory. And my Indigenous community has had a traditional Indigenous medicine system that has existed for thousands of years, that is evidence-informed, empirical, time-tested, sustainable, and net zero. Now, in our traditional medicine systems, the environment is absolutely not separated from the patient. They are utterly and completely interconnected. Any treatment, any prescription, any recommendation is done in concert with the patient's reciprocal respect and responsibility to the lands and waters around. So because of this, there is no separation between, again, the health of the patient and the health of the planet in the consideration for a prescription. They are completely joined. In fact, many of our prescriptions or treatments, so to speak, are done with a specific intent to ensure that there are co-benefits for the patient and for the environment or planet. For example, we have a traditional medicine, it's a plant medicine that when it's picked for use in a sustainable way, it actually grows better. However, when you don't pick it, it stops growing well. Also, if you overpick it, it stops growing well. There's this delicate balance of needing the action, it needs to be groomed, it needs the attention of us as humans. We engage with this plant by asking for its medicine, and in return, the medicine plant thrives for us. So co-benefits is a term that is now often used in many sustainability fields and circles. A co-benefit approach considers how climate change mitigation initiatives can also advance other policy goals while also leading to improvements in health. Now, of course, one classic example within the Western healthcare context, which you'll likely be learning about more at some point, is in regards to meter dose inhalers used, of course, for asthma or other lung conditions. And meter dose inhalers have been clearly identified as having a large environmental footprint, being potent greenhouse gas emitters. 100 dose meter dose inhalers, about the equivalent to a 290-kilometer car journey. However, dry powder inhalers, on the other hand, do not have the chemical propellant to push the medication out of the inhaler, which is, of course, what is the issue with the greenhouse gas emissions, at least in the context of acute use. Now, with this component, we can start to appreciate, at least within the Western context, a type of prescription where we may actually consider the potential benefits to patient, but also the potential benefits to planet, hence patient planetary health co-benefit prescribing. Because when we think about the care that we give, the lens of the world really clearly affects how we see our innate hierarchy of ourselves over all other beings on the planet. Where does the planet fit within the clinical exam room? And for traditional medicine, that answer is incredibly clear. So with health equity considerations in research and practice being thankfully more common in our modern discourse, what is also important is denoted here is an interspecies equity approach that is seen from a place of relationality or relationship. We are all interconnected with no hierarchy between us when it comes to how the natural systems operate. We are just a small part of a greater system. Now, I talk about equity from many different lenses. On the previous slide, interspecies equity was highlighted. However, we also have to understand notions of intergenerational equity, which is a prime consideration for Indigenous communities, often making decisions based on their effects on the next 7 generations to come. So here now you have an additional component to the caretaking of a patient, which is not only the benefit of that patient, but the benefit of the patient's future children, grandchildren, families for the next 7 generations. Now, this interconnected nature intergenerationally is also depicted by this figure here on the slide. Because we are unified communities, again, due to this interconnectedness that I keep bringing up, which is so incredibly important from an Indigenous worldview on all of our structures and influence, yet there's also a clear interrelationship with repercussions for not living in balance with the planet, for not providing care within balance of the planet, because of what's called Earth-centered jurisprudence systems, which govern both nature and global systems, meaning there is a unity of natural laws between us, because as we know, the sun will continue to rise from the east and set in the west. The moons will continue to affect the tides, but Mother Earth will also respond to our interactions with her, which ultimately affects all other life forms, because again of this interconnected relationship. So in the vision for a healthy future, it's important to create the conditions that enable the overcoming of the dissonance between this idea of being in nature, going out in nature, comparatively to being of nature, nature that embodied us. We are in and of itself nature. So I had broached the concept of natural law or first law previously, which is the way of living on land or country that's handed down through countless generations. It sustains a web of relationships between the human and non-human world and forms a pattern which is life itself. And this pattern must be recreated and the law followed to sustain life, to be sustainable. Now, Indigenous traditional knowledges are directly nested within understandings of natural or first law, whose meaning, again, is very uniquely rooted within the respective lands globally that Indigenous peoples come from. And as Elder David Kosher of the Anishinaabe Nation confirms, working in alliance with nature and her natural laws is the key to ensuring our survival. The reason we have climate change is because we have broken natural law. What is natural law and how can we find our balance again? The spirit in each of our beings carries moral and ethical principles of what should be the basis of our human conduct. We understand these moral principles as natural laws. Natural laws are innate to all living beings. They are the invisible laws that govern all life. All living beings, including Mother Earth herself, are governed by natural laws, whether they know it or not. So as we confirm and emphasize the Indigenous perspective that there is no separation between ourselves and that of the earth, with complete interconnections existing that really precludes an isolated definition, I reflect on the fact that even our names and identities come from the land. I come from Dene peoples of Northern Canada, from the land of Denede, as I noted before, land of the people. And if we break down the word Dene in one of our Dene languages, De means flow, Ne means land. So we are literally flowing from the land as Dene. We have a relationship with the land. Our very being flows from the land and the land from its people. And the concept of flowing from the land roots us within our landscape and creates the culture. And as such, the teachings about the land serve as the essence of our being, of who we are. There is no separation from the land. And when there is, dysfunction arises. So why is this important for me to state again? And I often think of the words of Chief Dan George, who was chief of the Tsleil-Waututh First Nation. And he said, allow me to learn the ways of your book knowledge so that I may contribute it, so that I may combine it with my natural knowledge and lead the way. Now, we as Indigenous peoples often have understood that a blend of traditional knowledges with modern knowledges is the way forward sustainably for the planet. I emphasize commonly within presentations this concept. It's a big word. It's called epistemological pluralism. Epistemological pluralism. But epistemological pluralism recognizes that in any given practice context, it doesn't matter if it's research, if it's clinical, if it's applied, recognizing in any given practice context, there may be several valuable ways of knowing, and that accommodating this plurality can lead to more successful integrative study, solutions, and practice. Now, I had noticed, many times that the change, of course, is slowly happening. And I really believe it's a deep reflection of the values, the vision, and purpose of what you're trying to do here as a collective community. But I also believe it was due to diverse voices standing up for their rights and really showcasing the strengths they offer to the global community in this time of great crisis and need that we have right now. But it's also occurred by allies standing up and stepping back to allow voices to be heard. And I think the more that we can continue to step back and uplift diverse knowledges, the more hope we have of getting us through these intersecting crises that we face. Now, of course, we've seen the planetary health movement really gaining a lot of traction in and around universities, organizations. The UN's getting involved, WHO now in these conversations, which is very positive. However, again, I remind folks repeatedly, planetary health is by no means a new innovative discipline, but a deeply rooted connection that all of our ancestors had to the land as a medicine place. So to understand the planet and its functions is to understand oneself in the Indigenous worldview. So if the climate change and health movement, if the One Health movement, if the planetary health movement, if the eco-health movement is to be successful, it will need to platform itself as more culturally safe, critically conscious, and have a greater appreciation of currently other marginalized Indigenous voices. However, we can also not forget in the complexity, and as Terry Tiji, a member of the Takla First Nation, stated, take care of the land, and the land will take care of you. Now, recently, a group of global Indigenous scholars, practitioners, land and water defenders, respected elders, knowledge holders came together to define what we term the determinants of planetary health from an Indigenous perspective. And of course, many have likely heard of the social determinants of health, which are the non-medical factors that influence our health outcomes. And many of the social determinants of health, which, have been very well defined, whether or not it's around education or food insecurity or housing. And of course, although these are incredibly important and not to be minimized, it was realized that Mother Earth was being left out of the equation as a living and breathing relative within these common global discourses. So we wanted to, for once, place Mother Earth in the center and consider what are the determinants that keep her well? What are the factors that will make an impact for her well-being? And I want to just highlight here a few of the determinants that I think are less well appreciated in wider climate and health circles, although that's slowly changing. And I won't go into detail on all of them, and will encourage you to see the paper online if you're interested, as it is available open access at no charge. And the first is the human interconnectedness within nature determinant. And we wrote very specifically that ecological demise points to an impaired human relationship with its inner self. because humans are nature and not apart from it. So in the broader sense, there is evidence of the loss of an ecologically bound cultural identity. The disconnect from nature that we have manifests itself as a fragmented and dissociated identity that cannot recognize itself as part of a system, making it easier then to project predatory and abusive impulses onto the environment. Thus, this ideology of independence has resulted in a sense of entitled ownership, a kind of utilitarian perception of the natural world that relates to it through transactional relationships that do not have a sense of responsibility, care, or love. And this worldview will only continue to perpetuate planetary harm. Now, the other less well appreciated determinant of planetary health that I want to highlight is that of Indigenous peoples' health. And we premise very strongly within our group's work that the health of the planet is intrinsically tied to the health and well-being of Indigenous peoples. Because when Indigenous peoples have their land, when Indigenous peoples have their culture, their sovereignty, they are more likely to have, of course, greater well-being. And when they have greater well-being, they will continue to be able to sustainably care for more than a third of the world's old-growth forests and the remaining 80% of the biodiversity left on the planet. So it's imperative that Indigenous people's health is approached from a holistic lens that acknowledges the cultural and land-based practices that we have as really being crucial for human health and for the health of the entire planet. And I think we've seen this very clearly within some of the large forest areas and even geopolitically with the Amazon region. Now, we concluded our paper stating that Indigenous voices are a powerful and beneficial solutions-oriented force for Mother Earth's well-being and for all living beings that inhabit her. We therefore call for an inclusion of wisdom that is not mere knowledge or information, but is an insight that comes from the heart of Mother Earth. Now, this paper attempts to provide some of the pathway in how to heal Mother Earth. And I encourage you, if you read anything else this week, to take the time to hear what Indigenous communities are saying in answer to this important question. Now, I always like to attempt to close with this quote from one of my dear sisters' research on land-based healing in the Canadian North, where one of the elders shared within the story and the relationship of this interview that land-based is one of those words. It's a beautiful, wonderful term. It's bringing people back to the land and helping them become alive and remembering their humanity and their connection to all living things. We are the land. So if we remember who we are, then the same miracle that we see all around us will be us. Indigenous knowledges remind us how to walk in the world in a good way. And the path we hopefully decide to walk is together, not only as a collective society, but also with Mother Earth seen as our relative. Because you cannot understand true medicine power in the context of our traditional Indigenous healing systems. You cannot understand true medicine power in whatever capacity that may be, unless you have an understanding of the nature of things. And to understand the nature of things, you need to be in nature. You need to connect with the animals, the rocks, the plants, the stars, and the winds. And our traditional medicine people, healers, knowledge holders knew this very well. And it's one of the reasons why we see such relevant land connections within our medicine systems. Now, for the health professionals out there, I encourage you to view the Planetary Health Pledge that we created a few years ago. And the pledge is an adaptation to the Hippocratic Oath and is meant really to stimulate reflection on physician and other healthcare providers' roles within planetary health as part of the medical care given. And one of the things that I often highlight is that, although we've seen very positive movements towards decarbonized health systems, health systems that are becoming more resilient and greater adaptation mechanisms put in place, there's a risk of things becoming very mechanical, very technical, and losing this important connection for why, the meaning, the interconnections on why this is so important. And I think this really, this pledge really kind of brings back the words of some of the things that we may want to consider as health providers going forward within our work. So for those that feel ready to take such a pledge, I invite you today in this moment. You don't have to come off mute if you don't want to, and you don't have to pledge if you're not ready to do that, but I will invite you to read this pledge with me now in an act of ceremony, because for us, ceremony is incredibly important, and a process of engagement, a commitment to earth, a commitment to people often starts with ceremony, and reciting something is a part of ceremony that we can engage with here today. So I've put the pledge up here on the slide, and I'm just going to see if I can move this out of the way so that maybe it can be seen a little bit better that way. Hopefully that maybe works. So with me, you can be on mute or you can be off mute. You can just mouth watermelon, watermelon. If you don't want to say the pledge, that's fine too, but hopefully we'll have a few people. I solemnly pledge to dedicate my life to the service of humanity and to the protection of natural systems on which human health depends. The health of people, their communities, and the planet will be my first consideration, and I will maintain the utmost respect for human life, as well as reverence for the diversity of life on Earth. I will practice my profession with conscience and dignity in accordance with good practice, taking into account planetary health values and principles. To do no harm, I will respect the autonomy and dignity of all persons in adopting an approach to maintaining and creating health, which focuses on prevention of harm to people and planet. I will respect and honor the trust that is placed in me and leverage this trust to promote knowledge, values, and behaviors that support the health of humans and the planet. I will actively strive to understand the impact that direct, unconscious, and structural bias may have on my patients, communities, and the planet, and for cultural self-awareness in my duty to serve. I will advocate for equity and justice by actively addressing environmental, social, and structural determinants of health while protecting the natural systems that underpin a viable planet for future generations. I'm afraid it's not done yet. I will acknowledge and respect diverse sources of knowledge and knowing regarding individual, community, and planetary health, such as from Indigenous traditional knowledge systems, while challenging attempts at spreading disinformation that can undermine planetary health. I will share and expand my knowledge for the benefit of society and the planet. I will also actively promote transdisciplinary, inclusive action to achieve individual, community, and planetary health. I will attend to my own health, well-being, and abilities in order to provide care and serve the community to the highest standards. I will strive to be a role model for my patients and society by embodying planetary health principles in my own life, acknowledging that this requires maintaining the vitality of our common home. I will not use my knowledge to violate human rights and civil liberties, even under threat, recognizing that the human right to health necessitates maintaining planetary health. I make these promises solemnly, freely, and upon my honor. By taking this pledge, I am committing to a vision of personal, community, and planetary health that will enable the diversity of life on our planet to thrive now and in the future. Masi Cho, thank you for going along with that ceremony journey of commitment to our planet and our health. And with that, I want to say Masi Cho, Thank you. Appreciate the time and the space today to share. Of course, these are vast and deep topics, really only touching the surface. But hopefully, as you go forward within your journeys, this will cause some pause and reflection on some of the components. Maybe next time when you are out for a walk or out in the park, sitting next to a plant, that you start to see the world just a little bit differently. Asi Cho, thank you.
Thank you so much, Dr. Redvers. As usual, it's always inspiring and enlightening to hear you speak. I want to thank you so much for taking time out of your schedule to speak with us today, and that was really cool at the end to end with that pledge. Now, if people have questions, please put them in the chat. I don't know if I'll be able to see hands, but I'll start things off. Maybe starting at the end, actually. I know that pledge for planetary health for healthcare professionals in the Anthropocene, it's a really beautifully written pledge, and that paper that was written, which you were a part of, that was published in the Lancet, it's great. It's a very moving kind of paper to read. It's very moving to do the pledge. You're now at Western. I'm wondering, are there plans during the white coat ceremony to have this included? I know you just started, but I'm just curious.
Yep, I just started on Monday. I finally got my office. I have lots of vast plans, but of course, it's going to take me a bit of time to get processes. But I have lots of grand hopes, for a number of reasons. I think with truth and reconciliation processes that we have being mobilized within institutional contexts across Canada, also in other areas as well, the renewed emphasis on indigenizing and decolonizing efforts, either under EDI programs or in isolation, have really been booming because of the need to create safe space for Indigenous communities. Yet we often sort of separate the Indigenous health components from some of these environmental conversations, when in actual fact, they're completely intertwined. So, by institutions remaining accountable to land, by institutions remaining accountable to our earth, automatically we're accountable to our relations and to the Indigenous communities' lands that we reside on. So I don't think we can really separate out those components. They need to be integrated and combined in our efforts as we think about decolonizing, indigenizing, and all of these things. Land can't be removed from that process, and responsibility to land itself.
I'm just curious, and I know I'm kind of putting you on the spot here, but I know you've just started there. I'm sure you have grand plans because I know you've done so much already. But do you mind sharing with us? You've just started as Director of Indigenous Planetary Health. Over the next, I don't know what what timeline you're looking at right now, but let's say the next kind of 1 to 3 years. Do you mind sharing with us what your, I don't know, maybe top 3 things are on kind of your list of things that you'd like to kind of see move forward?
Yeah, absolutely. As you noted, lots of different plans with that. But having said that, I do have some clear objectives on what I'm hoping to see as a part of the work, and really which is falling under the research chair in Indigenous planetary health that I've been blessed and honored to be able to go forward with. Now, when it comes to Indigenous planetary health, and I very specifically say Indigenous planetary health for a reason, because of the approaches and the things that I talked about here today, and the importance, of course, of highlighting sometimes the differences that fall within the planetary health space, and what that means in terms of the kinds of objectives that may or may not need to occur as a part of this work. Regardless of that standpoint, there absolutely needs to be interconnections and more communications happening. And I think more and more we're starting to see these Indigenous components reflected very very clearly within all sorts of efforts that have been occurring. So objectives that I have really is to mobilize, hopefully adapt, but also advance Indigenous traditional medicine and land-based healing frameworks for application in the development of environmentally sustainable health systems. I hope to develop more clear implementation strategies and approach that really platform Indigenous ways of being, ways of knowing, and ways of implementing for training students, health scholars, and health professionals in applying planetary health and sustainability practices within the education and delivery of healthcare. And then really my probably most exciting component, not that the other components are not important, is to support a local to global network of Indigenous students, scholars, and health professionals seeking to advocate and amplify Indigenous voices within planetary health and broader climate and health spaces. I'm kind of jokingly calling it my, well, not my, but calling it a think tank, because we got to think of a better word, but really sort of this way to group Indigenous knowledge holders, because we really haven't had a space, you know, to situate ourselves together to really grapple with some of these big, large, you know, critical questions that society is facing today, you know, without being pulled into multiple spaces or being the one voice or, you know, two voices perhaps in a space. How can we get these knowledge holders together within space and really start to tackle from their perspective some of these key issues that we really need Indigenous perspectives on? And then also trying to collate transdisciplinary collections of Indigenous narratives on Mother Earth-centered determinants, kind of like what we've seen here, but really locating them to place and to land and in context more specifically. So those are kind of a few of the things I got up my sleeve.
Nice. No, that sounds awesome. And I see there's a question maybe based on what you were just saying from Christine saying, is the ultimate intention to change the standard of care for certain approaches to medicine or therapeutics?
Great question. I think, you know, what we've seen very clearly at the international scale from the WHO, you know, from some of the networks and organizations, Wonka Environment, is really focusing on primary care investment and prevention. That really is sort of the key piece, because we do know that if we invest more upstream, that, you know, it leads to less high intervention costs later on. Now, that's kind of the, you know, the global discourse and narrative, which is really coming through. Interestingly enough, within planetary health spaces, we're seeing a lot of conversations within Western care providers moving towards things like lifestyle medicine and all sorts of things that really start to bring back some components that arguably could be said to, you know, derive from traditional medicine systems around the world and the applications for that. I do feel that there is essence a need for standard of care change, because clearly what we're doing is not working. Clearly what we're doing is contributing to harm as a healthcare system, with, you know, approximately 5% of global greenhouse gas emissions due to the care that we give as health systems, which is twice the aviation industry. I mean, that's bonkers when you think about it. Here we have systems that are supposed to be, you know, helping people, but in essence are actually making people sick as part of that process. So, you know, to be able to work through this, yes, we can think of decarbonizing options, you know, MDI inhalers, anesthetic gases, those types of things. But the majority of the global gas emissions that come from healthcare are from supplies and pharmaceuticals, those two components. So what does that mean for healthcare? If those are our two main components, you know, if we're looking at prevention, what does that mean in the delivery of care? Because right now we often lead and practice very reactively. And of course, COVID hasn't helped that situation, not to the fault of any providers, but just the way that we've structured our systems. We need creative and innovative thinking, because even if we make the changes that groups like Healthcare Without Harm has proposed, there's like a gray area that they always leave in the bar graph. And basically what that gray area is that we have no idea what we're going to do with this part to get us to net zero. And that's the area that I like to think about, because I think there's a lot of room for innovative creativity bridged from things like sustainable medicine systems, traditional medicine, for example, that can really help us to think through, how do we deal with that gray box that is not getting us to net zero, even despite all of the other decarbonization plans. So it's worthy of some discussions. And I think we haven't had enough creative thought to really think through what does it mean to be net zero as a healthcare system? Is it possible the way that we're currently conceptualizing that? And do we need to think outside of the box to ensure that we have a healthy planet for all?
So thank you. Again, lots for us to reflect on here. I'm going to switch gears just a little bit. We have a lot of people on this call who are going to be leading change, whether it's at a department level, there's medical students, there's residents, there's, again, representatives from pharmacy. On some of these teams that people work on, there may not be Indigenous people on those teams. And so my question to you is, as these teams move forward, let's say as I move forward with some of my works or my projects, and if I don't have someone who is Indigenous on that team, now listen, I read all your papers on a regular basis. I'm going on PubMed and making sure I'm like reading what you're writing. But how do you suggest to us to practically incorporate Indigenous thought at the basis of what we are trying to do?
Absolutely. Well, I think the onus is difficult for one-on-one providers making change movements, but I do feel that there's an institutional responsibility as a part of health systems or hospital to ensure that they have elder circles, councils, those types of things that are really there for the purposes, of course, honored in a good way, to participate in dialogues with various change mechanisms that have a governance structure that allows the feedback of people from the lands that they come from. And we've seen this success within our health system in the Northwest Territories previously, where we had an elders council that was representing a number of different health systems in there and met quite regularly to tackle and provide advice and guidance for ongoing things that were occurring. I would love to see those types of initiatives be more across the board within our health systems, not only for this issue, but just for all of the multitude of issues that, of course, affect Indigenous health and communities in which the environment cannot be separated away from. Does that mean the mechanical participation in day-to-day activities? No, but it does help root the perspective and really root the meaning and the context of why we're doing things, so that we don't start spinning and spinning and spinning without remembering what it is that we're actually doing, why we're doing it, and who we're doing it for. Oh, I think you're on mute.
You think after a few years I'd figure that out. Anyway, this is from Valeria Dimitrova. She's saying, "Dear Dr. Redvers, thank you so much for your presentation. I feel that pledge should be added to the Hippocratic Oath for incoming health trainees. I was wondering whether you had any advice for medical students in particular who are involved in planetary health initiatives, and how we can better involve and engage Indigenous frames of thought, because it is so important."
Great questions. And I will note that, Kathy Wabinitz, who was sort of the ringleader of the Hippocratic Oath, presented to one of the world organizations about updating the Physicians Code of Medical Ethics. And I'm happy to report that as of October, the Physicians Code of Medical Ethics was in fact updated, now containing responsibility of physicians to serve whole societies, but also future generations, and that physicians should strive to practice medicine in ways that are environmentally sustainable, with a view to minimizing environmental health risks to current and future generations, and that physicians should share medical knowledge and expertise for the benefit of patients and the advancement of healthcare, as well as public and global health. So that really sets a precedent and a framework at the international level for considering some of these components. Now, funny enough, we actually have had some medical schools and some nursing schools who have implemented the Planetary Health Pledge as a part of their process, particularly in the Philippines, in Minnesota, and we've seen a few groups in Europe, all led by medical students. So it was medical students that were able to make that change. Now, medical students have also been the leaders of curriculum change around planetary health, both in Canada, of course, which you may be hearing about with the heart competencies group, but they have also made substantial changes in Europe. The Planetary Health Report Cards, now a report that is done by students, medical students, although nursing students will be starting that too as well, grading their medical schools for their coverage and incorporation of planetary health. So if you are at a medical school that does not have one, then I always encourage you to consider bringing students together for that and telling other students at other medical schools in Canada about that process, so that we're putting more pressure and a little bit more oomph on leadership to say, okay, well, look, so-and-so university is doing this, but we're like the worst in Canada right now. And you'd be surprised what, physician leaders do when there's a bit of competition.
Yeah, no, totally. So we are doing the Planetary Health Report Card, and of course, our medical students here are fantastic. We're batting a solid C. So we have room for improvement, but we made some improvements. So and we are actually, our curriculum renewal is going to include planetary health longitudinally. So we now have a working group working on that. So some progress here. I have 2 more questions here, and we have 4 minutes left. So I'm going to give you both questions, Nicole, and then so the first one is any social media feeds to follow to learn more about planetary health. If you have any recommendations, I mean, I follow you on LinkedIn and on Twitter, but if you have any others, and then from Nahid Azad, his question is: we focus on care quality and safety in our practice. We need support for Q&S projects addressing pollution, waste, and plastic production by healthcare activities. Will the Faculty of Medicine provide funding support for this type of initiatives? I guess that's more directed to me. And I guess what I can say is we're working on it. We're trying to get more money into kind of funding for these types of activities, and certainly we'll hopefully see some movement on that. But certainly there's great support from the medical school, from the dean, vice dean around this. But back to you, Nicole. Any recommended social media feeds or reliable sources of information on planetary health, on Indigenous planetary health, and any final words as we have 3 minutes left?
Absolutely. And then just a note, as you know, about the Cascades project, which I believe is offering funding, small funding for quality improvement projects as well. So they're based out of the University of Toronto. Fiona Miller is running that. So that would be somebody to check in with for funding questions for projects like this. So for social media stuff, probably the most, a few most active sites are the Planetary Health Alliance, which is based out of Harvard, or PHA. They actually just had their annual conference just 2 weeks ago now in Boston, based at Harvard. They're very active in social media and tend to share a lot of broad spectrum knowledge and practice around it. They're also excellent in terms of their resources on their website. They also have a clinicians call, which happens quarterly, which is organized by Dr. Teddy Potter. And you can sign up for the clinicians call on their website. They have speaker series, but also engagement one-on-one for connecting and networking with those that are doing this type of work. And then In Vivo Planetary Health is the other planetary health organization, although they have just changed their name to the Novo Institute. And they also share and have planetary health conferences. In fact, their next one is coming up in December, if I remember correctly, and that's run by Dr. Susan Prescott, who's an immunologist pediatrician, who's absolutely excellent. And then there's a number of individual people that I think are really active within this space of all ages. And what I usually suggest people do is, if you go to my Twitter, as long as it doesn't burn itself down in the next few days, and go to who I follow, you'll often see Planetary Health in the headings. Many of the folks that I do follow in that work. And most of the people that I follow is for a reason. So if I'm, well, for the most part, I don't want to hang my hat on that, but there's a lot of good names on there, you know, individuals, but also people from institutions, from WHO, from the UN, from Indigenous organizations. So that's probably a good repository of some of the folks in this field.
Awesome. Thank you. And that brings us to 6:30. I know you know, there's more questions I have, and I'm sure other people have. And again, I just want to thank you so much for spending time with us. I want to thank everyone who came out to this webinar. I know, you know, you have lots of pulls on your time as well, and it is awesome to see you here. You know, please, again, feel free to reach out to me as well if you have any questions about what's going on here at University of Ottawa Faculty of Medicine. And for those of you who are doing the community practice activities, log on to the Brightspace. And yeah, you know, it's we're excited to get this going. Really excited that you kicked this all off for us, Dr. Redvers. And yeah, thank you, everyone. I hope you enjoyed the evening. I certainly did, and I hope you have a good rest of the evening as well. Take care. Have a good night. Bye.
Bye-bye.